And I'm going to move on now to our next speaker. So do we have Ciara? Hello, good morning and welcome. So I'd like to welcome Ciara Conlon from the Iris Centre in the School of Nursing, Midwifery and Health Systems here in UCD. And she's talking about understanding paediatric emergency department trends during COVID-19, a qualitative study. Thank you, Ciara.
So yeah, my name is Ciara Conlon, and I'm a research assistant in the Iris Centre here in UCD. And the study that I'm going to talk about today is in relation to paediatric emergency department attendances during COVID-19. So this study is part of a wider project called the Cupid COVID-19, and that's led by Dr. Emma Nicholson and Dr. Therese McDonald in the Iris Centre as well. Our research aim was to determine if children are continuing to receive timely access to emergency healthcare during COVID-19. So, you know, there were reports and studies starting to show that emergency department attendances were declining, and there may possibly be adverse outcomes to that, and so it demanded some attention. So it's a multi-method project, and there's three components to the project. So the first one was to assess the temporal trends and patterns of paediatric ED attendances during COVID-19, and that study has been completed, and we found that there was a 46% decrease in the 3-month period between March and May of this year when compared to the same period in the previous 2 years. And the second component is the, the second component is the study that I'm speaking on today, and that's a qualitative study that will utilize frontline staff perspectives to understand the emergency department attendance patterns. And the third component then was a cross-sectional survey of parents assessing avoidance and hesitancy towards accessing healthcare for their children during COVID-19, and that study is also being completed, and actually the paper published today, and that also found that there was 35% of the sample of over 1,044 parents of that sample, 34% indicated that they did need to access healthcare for their children, but 22% decided against it. And there was levels of over half of the sample were quite hesitant towards accessing healthcare. So moving on to the methodology of this study. So we had two main aims, and the first aim was to understand trends in paediatric emergency healthcare utilisation during COVID-19. And the second one was to understand the experiences of working within the restructured health system from the perspective of the frontline staff, but I will only present on findings in relation to the first aim today. So we carried out 15 semi-structured interviews with healthcare professionals, and they were carried out remotely between August and October of this year. We had quite a multidisciplinary mix of healthcare professionals in our as participants. So we had emergency medicine clinicians, nursing managerial staff, hospital social workers and nursing staff as well. And we applied a thematic analysis to the data, and we obtained ethical approval from the COVID-19 National Research Ethics Committee. So just to give you an overview of the four key themes that we found. So the first one was declines, delays and avoidance, changing paediatric presentations. We had a number of sub-themes there as well. Parental concerns, contagion and messaging. The third one was psychosocial impact on children. And the fourth one was disrupted access to community healthcare. So just to talk on the first theme that we found. So no surprise, you know, it really echoed other studies, including our own, that there was a decline in presentations. Clinicians felt that they absolutely dropped after restrictions were announced. In terms of the nature of presentations and how they changed, it felt that there was a real reduction in what was termed the bread and butter of presentation. So that would be your viral or your infectious sort of diseases, and that would be, attributed to the fact that schools were closed and living conditions were changed, and people weren't meeting as much. A rise in mental health presentations was widely noted as well, and I will talk about that more later on. Moving on to delaying attendance then. So the clinicians, probably all of our participants really observed, some cases of delayed attendances. And as the quote says, there was a sense that they were seeing sicker children. So they said, they were seeing children presenting with more progressed illnesses, and a couple that were mentioned was, pneumonia, meningitis, malignancies, diabetes ketoacidosis, and things like that. They did stress that it was a small number, but it was significant and it was concerning, and it did lead to some prolonged treatment or worsened outcomes for children. So the quote there, the management of his care, could have been less severe had he presented earlier, and that was in the case of a child who had displayed some concerning symptoms for a few days, and it actually suffered from a stroke, and the parent had sort of been quite hesitant to attend because they lived in an intergenerational household and they were afraid of the risk of contracting COVID in the hospital and bringing it home to the at-risk household member. And so in that case, that the management of the child's care could have been less severe had they not delayed attending. Children with chronic conditions and sort of complex needs were identified as possibly a cohort that were avoiding attending, that they weren't seeing as much. They felt they were trying to stay away. And there was, I think, a couple of participants who also were involved in delivering support services to the home, and they, reported that families were quite reluctant to allow those services into the home, and they were quite concerned about the burden on families during that period, and not having respite and not having the support that they needed. But it was also highlighted that alternative pathways to care were implemented, particularly like telemedicine and things like that, and that may have mitigated the need to present to the ED. And again, changed living conditions and not mixing with other people as well, and not catching those sort of infectious diseases and things like that. So moving on to the second theme then, and this is to do with parental concerns, and that mostly focused on contagion and messaging. And this is, fear of COVID was really cited as quite a main reason for delayed presentations and apprehension to attend the ED. So parents were really afraid of contracting COVID in the hospitals. And clinicians got the sense that parents were really, doing their best to manage the illness at home. One stated that the parents were pushing their boundaries and really trying to deal with the illness at home. And they were weighing up the risk of attending, the ED against the severity of the child's illness. That they might have been able to manage better at home without, being exposed to COVID-19. And parents reacted really well to it, and they felt reassured by the infection control measures that were implemented in hospitals. And that kind of points to sort of, as I'll talk a bit in the next one, is about communicating those measures that were implemented and reassuring parents that they were in place and that it was safe to attend. So the next sub-theme then was public health messaging. And so we were all told, to stay at home, stay safe. And, clinicians felt that parents, felt that extended to, in some cases, extended to, health services. And they felt, it was better to stay at home rather than to attend the ED, in cases. And so there was also a perception that hospitals were really busy. They were overwhelmed with COVID patients. And parents were sort of apologising to clinicians when they attended, saying, look, we really didn't want to come. We know you're at the pin of your collar. We don't want to contribute to your burden. And so, and that was actually, the opposite of the reality. The reality was hospitals were really, pediatric EDs weren't busy at all. They had declined, and they had plenty of capacity. So a public communication strategy was, pointed to by a number of clinicians that to alleviate the concerns and to prevent delays and avoidance and ensure children are still accessing healthcare. So going on then to the psychosocial impact on children. So clinicians felt that, it really took a big toll on children, and this manifested in increased attendances for mental health conditions in the ED, both in children who had existing mental health conditions, as well as first-time presentations as well. And it was particularly evident in the adolescent population, but it wasn't limited to them. And, there were cases of 8 and 9-year-olds attending with panic attacks and things like that as well. They highlighted a COVID-related anxiety, that children were sort of expressing their concerns that, what effect the pandemic was having on their family members and afraid of them dying and things like that. So yeah, an anxiety related to COVID. And as well as that, the closure of schools and social isolation and a lack of routine for children may have compounded their anxiety and psychological well-being. And crucially, the disruption of mental health services in the community, also would have affected children and leading them to, families to presenting in crisis, going beyond their ability to cope at home. And just, following on from that, the final theme then is disrupted access to community healthcare. And, in terms of primary care, clinicians felt that parents were left without their normal systems and supports. And parents were saying they were unable to secure appointments in GPs. And that led to infant vaccination schedules. Also, there was difficulty in maintaining vaccination schedules. And the public health nurse visits, they were suspended, and that left new mothers feeling vulnerable as well. And so that really led to, what was termed like a loss of a safety net. And there's sort of 3 aspects to that. So the mental health services being suspended, and children not being able to attend their usual appointments. And they felt they were falling through the net. Children with developmental or neurodevelopmental disabilities, such as autism, were unable to access their specialist schools and may have been disproportionately affected by that. And also children from more vulnerable backgrounds, children who may be at heightened risk of neglect during that period. There was a lack of a safety net for those children who, weren't attending school anymore, and clinicians, felt that normally teachers might pick up on certain issues that, were being missed, and they were falling through the net. So there was a loss of a safety net. So just to conclude then, so clear and uncomplicated public health messaging is essential, and it can play a role in combating parental fears and reassuring parents to continue to present and to ensure children have timely access to appropriate healthcare. The interruption to healthcare delivered in the community is manifesting in multiple ways in the ED, and that's including in a rise of psychosocial presentations in children. Thus, policymakers and service providers must ensure to continue the provision of essential health and social services, including targeted responses for those who may be disproportionately affected. So that's it from me. Thank you very much for listening.
Thank you very much, Ciara. Very interesting presentation there. So you have, apologies. So yeah, and I think, so do you get the impression that there was a missed opportunity to communicate more widely with the parents of children who might have been ill, telling them that they should be bringing their children to hospital?
Yeah, I think clinicians had a sense that that could have been stronger. Like I know there were some, you know, announcements at some stage, was it NEFID or some politicians were sort of highlighting, oh, you know, that health services are still open. But I think that it was felt that that message could be stronger. And I suppose in terms of like the measures that were put in place, like maybe they weren't communicated as well. And the fact that parents were really adherent to those measures and were really reassured when they arrived at the ED, and there was a streaming process in place. So if you had suspected COVID, you go this way, and if you don't, you'd go this way. And clinicians said that parents were really reassured by that. So possibly if that was communicated a bit more, you know, yeah, they felt that could have been a stronger message to going forward, yeah.
And then another question has just come in, whether the children in the families attending emergency departments, were they following referral from a GP, or were they direct self-referrals?
So I mean, a lot of parents were stating that they couldn't attend the GPs, that they would find it difficult to get appointments, and that also the remote telemedicine, you know, having the consultations through telemedicine, it was more difficult, I suppose, for GPs to really, you know, figure out what was the issue, and they were maybe being referred. I think some of the participants felt that there was children being referred quite easily, you know, more so than for issues that may have usually be treated in the community.
Yeah. Okay, Ciara, thank you very much indeed for a very interesting presentation.